May I just recognize once more and acknowledge the contribution this afternoon of the members of our Universal Healthcare Advocacy Panel. We've heard Dr. Romualdez, Dr. Flavier, Dr. Domingo, Dr. Melgar, Dr. Go, and the one person who wasn't introduced properly. And I take this opportunity to introduce him, Dr. Ramon Pedro Paterno, who is a research faculty of the UP in Manila National Institute of Health. Dr. Paterno has been a primary healthcare practitioner since 1977 and was a consultant of the DOH Doctors to the Barrios program from 2001-2002. We have some alumni from that program here. An advocate of universal health care, Dr. Paterno has conducted validation studies of the PhilHealth as part of the UP Manila National Institutes of Health mandates. You may have noticed that this forum consists of two parts, a briefing and a dialogue. You may also have noticed that the questions that were posed as a challenge were originally crafted for the presidentiables in the coming election. And invitations were duly sent to those who were aspiring for the highest office of our country. Unfortunately, only one was brave enough to come this afternoon. MMDA Chairman Bayani Fernando, who after this afternoon's forum, I hope, will merit more than the percentage in the Pulse Asia survey that he got recently. I was told that the PhilHealth is also here, represented by its president, my kabalen, Dr. Ray Aquino, somewhere in the audience. Now we come to the dialogue portion. The purpose of the dialogue, which is the Malayang Talakayan portion, is actually for us to respond to the challenge that was heard to us this afternoon. Do we agree with the analysis, the diagnosis of the Philippine health system that was presented to us? I noticed that the diagnosis consists of 6 symptoms. They have pointed out to the unequal access to health services and products, the fragmentation and the attendant waste of the current health system, the virtual lack of regulation and the bias for business profits, especially for health-related products, the weak leadership of mandated government health institutions, and the need to democratize the governance of the health system, the disconnect between the training and deployment of health personnel in relation to the needs of a sustainable Philippine health system, and lastly, the absence of a functioning health information system. Do we agree with the symptoms? Do they miss out anything? If we do we think that the prescription that they provide is adequate to solve the problems that they have identified? This is a free forum. The rules are very simple. Please identify yourself. Ask your question, preferably just one point at a time. And then, if it is a question, please identify the person to whom you wish to address it. We have about an hour. I shall traffic the dialogue. Since Mr. Fernando was the only brave one to come today, he has the option to ask or to comment on the presentation, only if he so wishes. We are not putting you on the spot, BF. But you have the honor of asking the first question, if you like, or commenting.
This is not a good time for me to comment. I'll be losing votes.
Bakit po?
Well, I might be stepping on some toes, but I might be accused of knowing too little of this subject. Because my experience limited to my participation in healthcare as mayor of Marikina, in that little town, little city. And but I have somehow an insight into the problem of the bureaucracy after my 18 years of public service. Your complaint very much similar to the complaint of every agency in government, in every sector in our society. And I would like to generalize the problem to the unproductivity. We have become so unproductive in practically every aspect. You see, we cannot even compete in rice production. So it's cheaper for us to buy rice in Thailand, from Thailand. Even yung tornilyo, ultimo yung lipstick ng babae, lahat. Mura lahat sa 168. Oh, Chinese made. No? It's cheaper to buy vegetables from China than the vegetables from Baguio. And it's cheaper to buy a door made in China than a door made by our carpenters. And pervades the whole system. Ganyan lahat. Even in healthcare, in every aspect. And so I think we have to look at this thing primarily. There's nothing wrong with the system. The structure is so good, I find. Sobra pa nga eh. Masyado tayong magaling kumopya. Naunahan pa natin yung managed countries sa pagkopya natin. But we cannot sustain. Dahil yung tao hindi gumagawa ng gusto. Yan ang number one. Nandiyan ang lahat eh. Hindi nagkulang yung mga nauna sa atin. Hindi nagkulang ang ating dating health secretary in formulating mga programs and all these things. Tama. So, what I did in Marikina, yun lang ang aking alam Marikina. With the same people, and even with the MMDA, with the same people, pinatrabaho ko lang yung bureaucracy. We have these changes now, we can say in Marikina, in Metro Manila. Same people. Practically not adding any more than the existing staff.
What you're saying,
and I did not have to formulate policies because the policies are so well made. They are all written. The local government code is there, detailed to the last requirement. But and so the only thing is to get everyone to do their work well. And one thing, political will. The way to push our people to do their job well is for us to have that political will. The political will to fire people. Because yan ang hindi na natin marinig ngayon. No public official, especially elective officials, can ever tell anyone to work well or you're fired. Wala makapagsabi. If only we can fire people, then titino yan. Kaya sabi ko, it's human resource, which is the most important thing. And we are failing in that aspect. And we have lost that political will to. Kaya,
may I just ask Chairman Fernando, if you were president today, would you fire the present Secretary of the Department of Health and the President of PhilHealth?
I'll fire. First thing, I will have to look into their organization. No? See, baka yung presidente may diferensya.
Okay.
So I will first look at what I can give the department, and if I have, kasi ano yan eh,
command responsibility.
Tsaka ano yan, tulakan yan eh. Tulakan yan.
Would you fire the President of the Republic?
Yes, I'll fire myself if I cannot support Yung my executives, no? I will have to find a way to give them the necessary support, and by then I'll make measure of their performance.
Salamat po, Chairman.